Okay, so I think we're good to go. So what are we going to talk about today? So by the way, in order to see my slides well, make sure you're not in the gallery mode. Go to individual speaker mode so that when I talk, you can see the slides better. Otherwise, you're not going to be able to read the slides. Okay, so something I learned yesterday. We were doing a presentation to Miami, University of Miami, and they asked, and I knew that I was gonna tell them that, but I didn't want to tell these doctors, you got to change your mode. Trying to accommodate them until one of them suggested that. Okay, so let's start continuing with our mesh stuff, mesh healthcare stuff. Unfortunately, there's just so much to say to understand healthcare. Remember, Maven went down in 3 years, supported by three largest corporations in the US. Healthcare is messy, and there's so much to say about healthcare. Ever since my incident back in 2008 when I had the blood clot, I've been reading about healthcare. It's one of my favorite bedtime stories along brain and behavior and psychology, right? I read about it quite a bit, but I'm not done. I'm still learning. Every day I learn something new. So it's very hard to put these things into half-hour sessions, but I'm going to try my best to do as much as I can for the benefit of each one of you. Um, so I'm going to talk about healthcare in Canada. There was no way I could put US or any other country in here. So let's just talk about Canada today, and then we'll do a session on the US, or many sessions. We'll see. Okay. Healthcare in Canada. This is our beautiful Canada. Okay. For those of you who are not in Canada, hopefully we'll get you there one day so that we can hang out together. But 10 provinces and 3 territories. That's what Canada is, from coast to coast, from the Pacific Ocean all the way to Atlantic, and then from the north we have the Arctic Ocean. So in terms of land, as you probably know, second largest country on Earth. It's about 10 million square kilometers, sort of about 5-6 times Iran, if I'm not mistaken. Anyways, and we have the longest land border, bi-national land border with the US, which is I think about 7,000-8,000 kilometers, if I'm not mistaken. So some facts about Canada, but we want to talk about healthcare. In order to understand healthcare, you have to understand in Canada, we have 3 levels of government. You have the federal government, provincial or territorial, and then we have municipal at the city level. So they're connected. And one of the reasons healthcare gets very complicated, it's because of the levels we have, okay? Basically, Canada's constitution set out the powers of these governments. Back in 1867, they sat down, they broke the deals, they decided who is doing what. And in particular, at that point, they decided healthcare is something that is the responsibility of provincial or territorial governments, not the federal government, although there are nuances here. But that goes back to the Constitution Act of 1867. Right? That's where healthcare is. So who runs healthcare? That's a fun story. Who runs healthcare in Canada? So as you noticed, it is mostly the provincial and territorial government level that runs it, but federal government has responsibilities, of course. Okay. So what are the responsibilities of federal government? The highest level. Federal government sets and administers basically principles, the main national or federal principles, and essentially is running what we call the Healthcare Canada Health Act, the CHA. I'll talk about that a little bit. So when you hear act, it's scary stuff. Okay, in Canada, as soon as you hear that, you got to be very careful. Call the lawyers. Employment Act, Health Act. You gotta watch it. That's basically the lingua franca, the Magna Carta, or the Bible that you gotta go by. Okay, so we're gonna talk about that a little bit. Financial support to provinces and territories comes from federal government, right? To run the healthcare system. So that's a lot of the money where the money comes from. Um, Funding and also delivery of primary and supplementary services to a bunch of groups is also a federal responsibility. They include First Nations people who live in reserves, Inuit people, um, and members of Canadian Armed Forces, and sometimes they're in Canada, sometimes they're outside Canada, veterans, inmates in federal penitentiaries, and specific groups of refugee claimants. Their healthcare is the responsibility of federal government. For those of you who don't know Inuits are indigenous people who live in northern Canada, Alaska, and Greenland, if I'm not mistaken. Okay, so that's what the Inuits are, and they have their own culture. There are groups of people together, and they're grouped together, and they're under this federal healthcare support. Okay, so the level 2, really provincial and territorial, as I mentioned, really runs the healthcare, but we need to understand the federal level health Canada Health Act to see how the bells and whistles are working together. Okay, so what does Canada Health Act do? In short, it basically sets the conditions and criteria that we have today for health insurance plans that we have in provinces and territories. Okay, and it's very important. Provinces and territories can go out and do their own thing, but if they do that, they're not going to qualify for the federal incentives, federal cash that is going to come to help healthcare, and also there are tax incentives that federal government has set out. If they want to benefit, they need to comply. So that's the problem, and that's a source of a lot of friction between the governments when they sit down at the table and talk about the nasty healthcare. Okay, so that's something to keep in mind. So what is the responsibility that the federal government has given to provinces and territories that they need to provide? And that's key, medically necessary. Okay, and I do quote, medically necessary healthcare stuff. That's what they have to provide. But the Healthcare Act does not define what is medically necessary. As you can imagine, this is really fun stuff for lobbyists, for pharmaceuticals, for a bunch of people who are making lots of money. Okay. And that changes constantly. In the past 4 or 5 decades, it has changed. So let's talk about the Act a little bit. What are the key components? The Act is really massive, right? If you want to understand it, but I want to talk about the key components of the Act that is going to be important for us as we work in MESH. First of all, the Act discourages extra billing and user fees. Okay, that's discourages. Again, look at the language that is used here. And this is where it gets funny. This slide is intentionally very, very convoluted. Okay, so I'll provide the slides to you, obviously, in the video. You can go through it. Look at the reading. This directly comes from the Act. Billing of an insured health service by a medical practitioner in an amount greater than the amount paid or to be paid for that service by the provincial or territorial healthcare plan, that is discouraged. But user charge is allowed. So it's a question of linguistics, right? No extra billing, but you can have user charges. And so it's like when you sign contracts, there is no, initiation fee or starting fee, but there are additional fees, stuff like that, right? So that's just the work and the way we do it with the government too. So it's unfortunate. That's the way it is. It's very confusing. So I'll keep it at that. We can get into the nuances of what they define as extra billing as opposed to user charge, but maybe that's for a different discussion. Okay, let's talk about the principle. There are 5 principles, folks, in the Act that the provinces and territories have to keep in mind. These are these guys. First, they have to keep this as a public administration component, meaning that it should be nonprofit, and organizations that run it, they should be accountable to the province or territory. That's number 1. It should be comprehensive. It should cover all medically necessary services. Again, we don't know what they are. We'll try to figure them out later on. Third one, it has to be universal so that every Canadian will get the same services. And that's probably the most beautiful thing for me as a human being. It's universal. So everybody gets access to it no matter what socioeconomical status they have. Again, that's in theory. It's a beautiful thing. The fourth one is the accessibility, that all insured people should have access in an equal fashion, regardless of financial situation they have. And the last one is portability, where people move from province to province, that they shouldn't feel like they're moving countries. Services continue, right? And also, when you go abroad, you have certain level of coverage, right? That's the issue of portability that is embedded into the act. I'm going to stop right here. Are there any questions so far? By the way, you can interject anytime, or any observations to make it more fun. Okay. All right. So
I just want to note that according to that, dental care is not necessary. Your teeth can all rot out of your head, and the government doesn't care.
exactly. Absolutely. Absolutely. It just doesn't follow science evidence. I don't know. It's all politics. It doesn't make sense. So, so what are the other federal roles? The federal government has a bunch of other roles. That's what they do, is that they do health protection and regulation. So they deal with the regulation of pharmaceuticals, food and medical devices, as you know, just like FDA in the USA, consumer safety, disease surveillance, prevention, fun stuff with COVID-19. They did great. Lots and lots of cool stories Ethan can tell you about how they did with this pandemic. But they were responsible to take care of a bunch of things. Support for health promotion and health research. They do that. We have the Tri-Council in Canada that cover research, and we have NSERC for engineering, CIHR for healthcare, and we have SSHRC for social sciences. So CIHR funding is coming from federal source, and instituting health-related tax measures, really to promote good behavior, right? So tax measures that are put in place mostly by federal government. These are in the form of tax credits for medical expenses, for disability, caregivers, and infant dependents, rebates that we have for public institutions, and deductions for private health insurance premiums for self-employed. These are all federal stuff. Okay. So, as we mentioned, provincial and territorial governments actually do the work. So they administer, deliver it. They have to meet the CHA, the Act, and they have to cover all medically necessary services on a prepaid basis. Okay, so the point here is that in this one, you can see they're not allowed to charge you at the point of service. That's a key component here again. Money is not, you're not actually touching money when you're dealing with healthcare. In Ontario, we have a green card called OHIP, Ontario Health Insurance Plan. That's all you touch when you go to see somebody in healthcare. So Amin will be touching one of those possibly at some point. Okay. So what is medically necessary? Let's talk about that a little bit. As Ethan said, dental care is not necessary, right? That doesn't influence your healthcare at all.
Yeah, one thing that came to mind is they still need to use our health cards when you go to a dental office. Why, if it's not covered?
God, in healthcare, there are a lot of places where you say why.
Yeah.
Nobody knows why. The why is very common. Yeah, I know. So let's talk about the medically necessary stuff, not unnecessary stuff, a little bit later on. But in terms of coverage, first notice that the Act does not define it. It has left it to the provinces and territories to decide what is necessary for their people, and that goes back to the health, the Constitution, where the Constitution laid out the responsibility of healthcare with the provinces. Okay, so they have to figure that out, and this is where things get really funny. There are lobbyists that work within each province separately to push a new medication comes out. You got the lobbies for that particular pharmaceutical company or organization that would lobby each province separately to make sure that medication is covered, right? Because if it is covered, they make more money, right? That's a very interesting dynamic. Okay, Now, what are the roles of provincial territorial governments as they deliver care? Okay, so we know they administer the insurance plans. They do the planning and funding of hospitals within their jurisdictions and health facilities that exist in each province and territory. They take care of planning services provided by doctors and other health professionals within the province or territory. They do the implementation of public health initiatives, and they pay for it. And they also negotiate fees with health professionals. Really fun stuff, this last one. Every so often you have the College of Physicians, organizations representing nurses, they come to the table, they fight. And at the end of the day, always the patient pays the price, right? Everybody wins, except for the patient. And patients have been getting less and less and worse service with time. Okay. So now let's talk about that a little bit. Actually, we do have a little bit of time. What else do they cover? So not all, but most, and I don't remember exactly which ones are at what level, but most provincial territorial governments have some supplementary benefits for low-income residents, seniors, and they do have it. They all have it, but the level is different for low-income residents and seniors, right? That's because I'll talk about that. Those people don't have access to private stuff or employment stuff, employment insurance, employment-related healthcare insurance, I should say. As a result of it, the government steps in and covers that. So drugs prescribed outside hospitals, ambulance costs, hearing, vision, and dental care, some of these. So if you're old, if you have any teeth left, they'll take care of it. Oh man, it's really funny. Oh, anyways, so let's go to the next. So again, that's not very, universal. So how do other people get drug and dental, right? We need drugs. Drugs are not covered. And so the way I get my drug coverage or dental coverage is through Queen's University, where I'm employed. That's what it is. So let's talk about that a little bit. So we do have private plans. It's not like, okay, it's universal healthcare, insurance is out. No, insurance still big business in Canada. So these are private plans. So supplementary, these are unnecessary stuff like cleaning your teeth and staying healthy there. These are the ones that are done with basically private plans. So we also have individual and families who don't qualify for whatever reason for the provincial publicly funded plans. And they go do that. So when that happens, folks, with the families and individuals who don't qualify, they either do out of pocket, that's possible, okay? Or they may be covered under employment-based group plans. If you work, your company, your employer might cover that. Or you will buy your own private insurance. It's one of these three that are very common, okay? Now, this is the fun part. Let's say you're 65 years old, you fall, you break your hip, and you go into a facility and they tell you, okay, this is not very urgent. It turns out, and this is reality, your broken hip is not urgent. So you have pain, you're dealing with psychological impacts of it, you don't have mobility, you're going to be bound to bed. That's not urgent. They might give you an appointment 6 months from today to do hip replacement. That's totally real number in Canada. It's not crazy. When that happens, you might say, hey, I got money. I'm going to sell the property and pay for my hip. Can I do it tomorrow? Can I buy a plan? You can't do that. Because this is considered a necessary process. Anything that is under the province necessary, by the act, it is required that nobody can pay for it. So you can't say, I'm willing to pay to get this done. Now, that's interesting. You can see that double-edged sword, right? You allow that, and all of a sudden, universality doesn't mean anything, right? And people are going to get preferential treatment. But at the same time, you're going to have situations where people just don't get the care they want. So for those people, I just want to let you know, some people then fly to the US, which is privatized. They pay 10 times more, and they get it done right away. There is a lot of trade. And also there are people who fly to places like Cuba. Cuba has a fantastic health plan, health system, very reliable. So there are people who fly to Cuba at a fraction of the cost, do this process and come back. And it's not just Cuba. There's an industry called health tourism. So they go and get the services elsewhere. So Canada has issues around that as a result. Okay. So now, who are these people? In Canada, we have about 6% of the workforce, which is about more than a million people, work in healthcare. Typically, they're within 4 groups, these people. They're doctors, nurses, dentists, and what we call allied health professionals. Okay, so where are these people? Doctors typically work this way. They mostly work in independent or group practices. They're actually incorporated most of the time, right? So they got their own company. And this is a disaster, in my opinion. Allowing doctors to incorporate and then benefit from, like, they work like you and me. We pay income tax, they pay corporate tax, which is a lot less. I don't think it's fair. Anyways, that's for a different discussion. But they're usually incorporated and work for themselves or within groups. And they're not employed by the government. They have deals with the government. So the lobby, the college negotiates for them with the government, how much money they get through OHIP or other provinces' plans. And some of them work in community health centers, hospital groups, primary healthcare teams. There's some variation there. And some are also affiliated with hospital outpatient departments. That's pretty typical. What about nurses? Nurses are a bit less complex. They're mostly working in hospital settings, but some of them also work out of public health units, community health units, and do home health care, which is something that is of interest to us, okay, for home healthcare organizations. Dentists, they're mostly work as you feel bad for dentists. Somehow they didn't lobby well, right? Somebody didn't do their job, and otherwise they would be covered, right? They're not covered. And because that dentistry is where you actually have customer support, customer service, you can demand stuff from your dentist. It really shows. When you go to a dental office, they've got, LCD screens, they give you coffee, maybe candy, because that helps business. But that doesn't happen in a primary care office. It feels like a jail. Most of them, you go broken chairs, cold, and they tell you to wait. You say, I've been waiting for 2 hours. You got to wait more. That's how it is. There is no service. So, that part of it is good, but the rest is not, and they're very expensive. They're not covered under the plans. So again, your employer under their plan would potentially cover some of the dental procedures, okay? Any questions so far? We're almost coming to an end. Okay. Allied professionals are these folks, that all the other people, dental hygienists, laboratory, technicians working in hospital settings and such, optometrists, pharmacists, physio and OT people, occupational therapists. By the way, you can always ask me if want to know more about these people. We can have a chat. Psychologists, speech and language pathologists, and audiologists. These are the people that we call allied healthcare workers. So the 13 jurisdictions, as we talked about, they have their own. So you can check these websites if you want to learn about each province or territory. For example, in Ontario, Ministry of Health and Long-Term Care is responsible for healthcare, and you can check their policies. You can, see how they do it, and get some more information from each of these websites. Okay. I also have, again, I don't talk about this. These are the, I would say, the most important links to look at, to refer to if you're doing research on healthcare in Canada. Health Canada, all the way to Parliament of Canada. They've got very cool stuff about healthcare and important things. In terms of organizations, these are I would say, the 7 most important organizations when it comes to healthcare. The Canadian Institute for Health Information has a lot of good data points as you're doing your research on things. And that is it. That is it. Any questions? 6:28. Yes, 2 minutes before. Didn't go overtime this time. Okay. So healthcare in Canada is nice. It's universal. Other than that, it sucks, in short. Okay, that's all I can say in summary. So we can fix it. We can fix it. Okay, one schedule at a time. All right, so I think you have a meeting coming up soon. If you have any questions related to these, let me know. US is a lot tougher, but I have put together a half an hour on the US as well. It's probably a lot worse than Canada, but we'll talk about it next. Okay. Any
Thank you,
questions?
Sharon. It was great.
Oh, okay, cool. Great talking. Great seeing you all. Take care. Have a great weekend if I don't see some of you. Bye.
Sharon, please come to the next meeting.
Oh,
You're
yeah,
invited.
I will.
Okay.
Okay.
See the tech team in that sprint meeting. Bye.